Your eye bags can make you look tired, stressed, and older than you are. There are a multitude of different types of eye bags, each with their own cause and treatment. Let's break all of them down so you can assess which ones you have and how you can get rid of them for good. All right, so let's first start by saying, why do we get eye bags? Well, they all form for different reasons, but usually they're caused by fluid retention, fat displacement, or thinning skin under your eyes. To treat them effectively, you need to understand what is causing yours. So here are the main types of eye bags and exactly what you need to do to get rid of them. First one is temporary puffiness. Looks like this. The causes of this can be fluid retention, allergies, a lack of sleep, and it gives that puffy, swollen look under the eyes. Second type of eye bag looks like this. These are fat-related eye bags. This can just be to do with how old you are, but it can also be genetic. When you age, the muscles around your eyes can just get weaker, causing fat to look like it's shifted forward. Your genetics may mean that your eye bags are just more predisposed to having fat pads there. Or for some people, your genetics can just make it so that you're more predisposed to having fat deposits under your eyes. The third type of eye bag, dark eye bags, like this. These can be from thinning skin, which is from a loss of collagen and elastin. It can be to do with your pigmentation. This can either just be your genetics or too much sun exposure. Or it can be to do with hollowing, which is volume loss under your eyes, creating a shadowed effect. And the fourth type of eye bag, which is your lifestyle-driven eye bag. This can be caused by anything from stress and poor sleep, dehydration, or excessive screen time. So how do you treat each type of eye bag? Firstly, treating temporary puffiness. If we're talking long term, you need to reduce the amount of sodium in your diet as a whole. Avoid salty foods, especially in the evening. Hydrate, drink plenty of water, 2 to 3 liters every single day to flush out any excess sodium in your system. And sleep elevated. If you haven't tried it, try sleeping with another pillow on top of your other one so that your head is more propped up to reduce fluid pooling overnight. Quick fixes for this type of eye bag are cold compresses, chilled spoons, cucumber slices, you know the drill, lymphatic drainage massages. You gently massage under your eyes with your moisturizer in the morning or evening in a circular motion. You promote fluid drainage in your skin. And you can also try caffeine-infused eye creams. Caffeine constricts blood vessels and reduces puffiness. Okay, how do you treat fat-related eye bags? Let's talk about long-term solutions. Topical retinoids. These are going to stimulate collagen production and improve your skin's elasticity. You've got skin tightening treatments. Procedures like radiofrequency or ultrasound therapy can tighten the loose skin around your eyes. Okay, let's talk about what doesn't work. Quick fixes like cold compress that is able to treat the temporary puffiness won't work so well here. You may reduce the swelling, but you're not addressing the root cause, which is the fat pads under your eyes. Okay, how do you treat dark eye bags? To treat the thinning skin that may be causing your dark eye bags, you can try vitamin C serums, hyaluronic acid, and retinol creams. All of these are going to brighten your skin and stimulate collagen production and overall give you a better appearance. To treat the pigmentation that might be causing your eye bags, make sure when you're in the sun, you're using sunscreen. Try and use one that doesn't have any endocrine disruptors in it. Always go for natural and organic when you can. You can also use brightening agents in your face products. Look for creams with niacinamide or kojic acid because these are going to reduce the discoloration in your skin. And to address the hollowing that might be causing these dark eye bags, the main way to target this is going to be through your diet. Specifically, you want to eat foods that are rich in vitamin K, like spinach or kale. These are going to improve the blood circulation around this area and hopefully reduce that dark appearance. Okay, how do you treat lifestyle-driven eye bags? Firstly, aim for better sleep. 7 to 9 hours of quality sleep every single night. The more consistent of a schedule you maintain, the better your circadian rhythm will be. And ideally, avoid screens 1 to 2 hours before you go to bed. Secondly, you need to be controlling your stress management. Try and incorporate mindfulness practices like yoga, meditation, or breath work. The goal here is to reduce the amount of stress you have in your life. You may think it's not for you, but I highly recommend you try it before you knock it. Once again, hydrate. Drink at least 2 to 3 liters of water every single day. And if you are going to be on your screen a lot through the day, whether it's in your job or at school, you can't avoid it, go for the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds, because this is going to reduce your eye strain. I have some general tips for a more holistic approach on how to decrease your eye bags. In your skincare routine, use a gentle cleanser to begin. Apply moisturizing eye creams, ideally twice a day to keep the area hydrated. And always pat the products into your skin, do not rub them. The reason for this is because the area of skin underneath your eyes is very, very delicate. Secondly, sun care protection. If you struggle with eye bags, try and wear a broad spectrum sunscreen daily. And also, if you're out directly in the sun, you're not tanning, wear some sunglasses. It'll help. Thirdly, focus on your healthy diet. Focus on foods that are rich in antioxidants and collagen-boosting nutrients, as well as your omega-3 fatty acids. And lastly, avoid any harmful habits like smoking or drinking. Smoking accelerates your collagen breakdown, and alcohol severely dehydrates the skin. smoking is going to worsen your pigmentation, and the drinking is going to exacerbate your puffiness. Treating eye bags is not an overnight process, but with consistency, your temporary puffiness, dark circles, or fat-related bags can all be diminished. Eye bags do not have to be a permanent part of your look. As always, consistency is going to take you far. Best of luck, gang.